welcome back to another video of Medic Notes. This video will be on beta-thalassemia. Thalassemia is an inherited blood disorder, which means it is passed down from one or both of the parents through their genes. There are two main types, which are the alpha and beta thalassemia. When you have thalassemia, your body will make less hemoglobin than usual. And this hemoglobin is a protein in the red blood cells that carries oxygen to all parts of the body. So with less hemoglobin, there will be anemia. And the severity and type of anemia will depend on how many genes are affected in the alpha and beta thalassemia. So in this video, I'll focus more about the beta thalassemia. Beta thalassemia is a blood disorder where there is reduced production of beta chain in the hemoglobin. So in a normal adult, in the hemoglobin, there are 4 globin chains, which are 2 alpha chains and 2 beta chains. So when there is not enough beta chains, there will be beta thalassemia. And this beta thalassemia is usually caused by point mutations in the beta globin genes on the chromosome 11. This is a classification of beta thalassemia. So, due to the mutation on the chromosome 11, it can lead to a reduce in production of beta chain, which we write as beta plus, or complete absence of the beta chain, which is beta 0. So various combinations of the mutations are possible. And for the first one, beta thalassemia minor or trait, it can be beta with beta plus or beta with beta 0, where there is complete absence. This is a carrier state, and it is usually asymptomatic, where the person having this beta thalassemia minor or trait, they won't have any symptoms. Whereas for the second group, beta thalassemia intermedia, it describes an intermediate state with moderate anemia, but they do not require blood transfusion, and they may also have splenomegaly. Whereas for the third group, beta thalassemia major is the most serious type, and it usually presents in the first year of life, where the baby will have severe anemia and also failure to thrive, where there is poor growth. So in beta thalassemia major, we will be able to see skull bossing, which is a characteristic head shape, and there might also be hepatosplenomegaly. This is due to extramedullary hematopoiesis in beta thalassemia major. On skull X-ray, we will be able to see the hair on end sign due to increased marrow activity. For investigations, you can do full blood count, expect to see microcytic hypochromic anemia, peripheral blood film to look for these specific cells that are seen in thalassemia, for example, target cells, teardrop cells, and poikilocytosis, where there are varying shapes and sizes of the red blood cell. You can also check the level of HbA2 and HbF, and also hemoglobin electrophoresis. This is an example of the picture of target cell. So the first picture shows the target cell, also known as Mexican head cells. And the second picture shows the teardrop cell. These are characteristic cells in thalassemia. For treatment, we promote fitness and make sure they have a healthy diet, and give folate supplements, regular lifelong transfusions to keep the hemoglobin level above the needed level. And these transfusions are done usually around 2 to 4 weekly to suppress the ineffective extramedullary hematopoiesis and also to allow normal growth. However, some complications the patient might face is, for example, like iron overload, where there will be further management for those patients. That's all for this video. Thank you.